Hello and welcome to Medical Dialogues. I'm Mr. Zaman and here's what I bring to you all from the world of medicine. Heart inflammation after COVID vaccine examined in new study. Researchers found evidence of heart muscle inflammation in a small number of patients with acute myocarditis after COVID-19 vaccination, but not in patients without acute myocarditis, according to a study published in Radiology Cardiothoracic Imaging Journal. Billions of people worldwide have received at least one dose of a COVID-19 vaccine. Most instances of myocarditis after COVID-19 vaccination have occurred in adolescent and young adult males. However, the overall risk is very low. Some patients may experience cardiac symptoms after vaccination, including shortness of breath, palpitations, and chest pain, yet do not meet diagnostic criteria for acute myocarditis. For this prospective study, Dr. Hahnemann and a multidisciplinary team of radiology, cardiology, and vascular biology, researchers set out to investigate cardiac effects of COVID-19 vaccination at 2-month follow-up and relate cardiac symptoms to myocardial tissue changes on fluorodeoxyglucose or FDG PET MRI, blood biomarkers, health-related quality of life, and adverse outcomes. Alzheimer's treatment by transporting antibodies across the blood-brain barrier. Researchers from Japan have found a way to ensure that new medications are delivered to the right place in the body and at the right time point in disease progression so that they have the best effect. In a recent study, researchers led by Tokyo Medical and Dental University have revealed that a novel delivery system delivers treatment to where it is needed most in a mouse model of Alzheimer's disease. AD or Alzheimer's disease is a common neurodegenerative disease that causes dementia. It is characterized by the accumulation of a protein called amyloid beta or A-beta in the brain, and a number of different toxic forms of A-beta have been identified that impair brain function, notably A-beta oligomers. To address this challenge, the researchers previously developed glucosylated or sugar-linked polymeric nanomicelles or PMs, which are tiny hollow balls that could successfully cross the BBB via transcytosis in mouse brain capillary endothelial cells. BBB stands for blood-brain barrier. This process was mediated by glucose transporter 1 and induced by an increase in blood glucose levels after the mice experienced fasting conditions. In this study, the team filled PMs with fragments of an anti-ABO antibody, injected them into a mouse model of AD, and assessed the effects on the brain and on behavior. Nirogacestat improves outcomes for people with sarcoma, shows phase 3 clinical trial. When Dana Avellino, now 36, first noticed a lump near her groin in the summer of 2018, she thought it was her recent cesarean section. Her younger daughter was only 2 months old at the time. When a biopsy revealed that the lump was a sarcoma, a type of tumor that affects the body's soft tissues, her doctors recommended that she go to Memorial Sloan Kettering Cancer Center. After other treatments left her with severe side effects, Dana's MSK doctor, sarcoma expert Mrinal Gounder, who's an MD, told her about a clinical trial testing an experimental targeted drug called Nirogacestat. Dana has now been taking the drug for more than 3 years. Her tumor, a rare non-cancerous subtype of sarcoma called a desmoid tumor, has shrunk so much that she can't hardly feel it anymore. Potential hemophilia treatment trial. A global study involving McMaster University researchers has trialed a potential new treatment that could be a game changer for people living with hemophilia A, which is a life-threatening genetic blood disorder. Co-principal investigator David Martino said that once weekly injections of efanesoctocog alpha can prevent bleeding and promote near-normal activity by the clotting agent factor 8, crucial for stopping the prolonged bleeding caused by hemophilia A. People who took efanesoctocog alpha also enjoyed improved joint function, better overall health, and less pain. With only one injection for an entire week, people with hemophilia A will enjoy normal or near normal levels of factor 8, which is unheard of. Previously, patients had to inject every other day, which was a huge burden for them, yet obtaining a lower level of protection, said Martino. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.